Should you be using a continuous glucose monitoring device to manage your diabetes? Well, this is something that has really come into the mainstream now in the last several years. Prior to several years ago, we just didn't have a way to measure glucose over a period of time. It had to be done through a finger stick, which has some issues related to it. But now we have several different glucose monitoring devices. And these glucose monitoring devices are both accessible and relatively easy to use, and sometimes a little bit on the costly side, but mostly are pretty available for most people. And so the question is, one, what does a continuous glucose monitoring device do? And secondly, should you use one? And so for the first question is, a continuous glucose monitoring device is a device where you place it usually on your upper arm, and it then records your blood sugar every 5 minutes and gives a reading to your blood glucose to your monitor. And your monitor these days is usually your phone. So there's an app on your phone, and the phone app will have the glucose monitoring information, and it will record that, and it has a memory for that. So that can all be used when you are seeing your physician to be able to look at your blood sugars over a period of days and then over a period of weeks to determine whether or not there's certain patterns in your blood sugar, which can be helped by certain either lifestyle changes or medication changes. And so what we have is really a way to really look at glucose over a period of time in a real time kind of experience. And so I think there are a lot of things that can be learned from this, particularly in relationship to meal times. Oftentimes, people are really unaware of what their blood sugar might do with meals, but you can see it very clearly when you have that glucose monitor on as to whether or not you've eaten a meal that has high in carbohydrates, high in sugar, high in fat, or you might see something different if you were eating a meal that had vegetables or protein and so forth. And so anyone who has had diabetes and has any experience with the dietary aspects would have some idea that their blood sugars would go in a certain direction based upon what they eat. But I think it's very informative for many people who have never seen this, what their blood sugars actually do when they eat certain types of foods. And then that's one thing that you can get from this glucose monitoring device. The second thing you can get is if you're taking insulin, you can see what your blood sugars are doing with that with the short acting and the long acting insulin treatments. And that really is a real benefit in patients who are either using carbohydrate counting or a sliding scale to give short acting insulin. It also gives you an ability to look at your fasting blood sugars, meaning your morning blood sugars, in case people are having some nighttime or even daytime low blood sugars. Particularly in nighttime, blood sugars may get low, and there's a problem that may not be identified because someone doesn't have the awareness of the low blood sugar. Most people will have awareness of blood sugars when they get down into the range of 60 or 65 or even 70. And so what the glucose monitoring device does, it has alarms on it, and it will give you the alarm when the blood sugar gets to a certain level. This is really important and can be life-saving if someone has this unawareness of low blood sugar. So it gives you a sense of whether or not your blood sugars are too high when you're eating something or too low if you've taken a certain amount of insulin or other medications. And so it really does give us a great deal of information. And I think that for many people with diabetes, it is an excellent resource and will be able to give them an additional benefit in terms of their ability to get better control of their diabetes.